will be clearly very active in monitoring the space. Maybe she's forcing you mute at times so that we can have a flow. But if you decide to intervene or have a question, use the raise your hand function, which is permitted in the bottom part of your screen where you have all the emojis as well. If your question, of course, can wait, then wait until the end. We'll certainly have time for Q&A. So that is the only information for those there. Welcome those who made it here. I appreciate seeing you. Some might still come in. Welcome. In fact, we see 3 more coming in as we speak. Or 2. Very good. Welcome. Please take a seat. Fantastic. All right, great. So I'm really honored and delighted to introduce you to today's speaker. Brian Kelleher is the Assistant Secretary General of Private Health Strategy Branch in the Commonwealth, Department of Health and Aged Care. Among his responsibility, which of course included the private health insurance, the private hospital policies and regulation. He has led, prior to this appointment, various teams within the department in the area of health payments, claim system, health policy, and of course he has had prior departmental roles in the Department of Communication. He will talk about himself as part of this wonderful opportunity for all of us. I've met Brian on a number of occasions as we have jointly been working together on important policy issues. So again, thanks Brian for coming in person, as well as for those of you who are remotely to meet all of you there. And please.
Thank you, Francesco. Before I start, I'd just like to acknowledge the traditional owners on the lands in which we meet, and I recognise there's lots of people in virtual space, so acknowledge the owners, the traditional owners on the lands on which you're coming to this meeting today. Before I get into giving you a little bit of an outline on what I intend to talk to and hopefully prep you for organising some questions so we can have a bit of a discussion, just like to say thank you to Francesco and also Mustafa. As Francesco mentioned, we have worked together on some things, and for the sake of giving some kudos and pats on the back, in terms of what I appreciate in my role as a leader of a team is genuine engagement. People are very open, net givers, you might say, in interactions, and Giuseppe and Francesco are just awesome examples of that. And so I think my task was to give you a little bit of a insight in terms of how I've got to where I've got to, what informs that, and then also talk a bit about some of the things I'm working on and some of the ways in which I engage with those issues. So this pitch is particularly to people who haven't worked inside the Australian government, and just want to have a perspective on some of the thinking going on in that space. But of course, this is just one perspective. I really hesitate to suggest you're getting a great overview of all the ways government goes about its business. It's really, I think, quite useful when we talk about leadership and managing issues. Try and talk about things that go wrong as opposed to just things that go right. I'm a big believer you learn more from the mistakes. So I'll hopefully touch on some of those as well. Just to make it extremely topical, from a Commonwealth government perspective, there's something happening at the moment that provides a lot of insight in terms of, let's call them mistakes or shortcomings, and that's the Royal Commission into Robo-Debt. And there's lots of people inside the Commonwealth who are looking at that not from the perspective of who did what, it's more how did that come about? What might I learn from it? The other great source, apart from your individual mistakes, as I think about it, and things that are occurring in the media and the topical, is when people do a deep dive and actually document processes when they didn't work and why. And from a Commonwealth perspective, the Ombudsman reports around programs, initiatives and policies that have not gone to plan or have had shortcomings, very equally, really informative. And mentioned it before, to keep this discussion as interesting for you guys, please ask questions, otherwise it might be a little bit tedious. I'll put in a couple of caveats. One, it's my perspective. Two, I'm not purporting to give a government view on where they want to take certain initiatives, so that will be personal. And if you hear me say something you disagree with, please challenge it. Again, I think that's a really important part of any interaction, particularly developing policy, is the extent to which you provide an opportunity for people to challenge. And from my perspective, the opportunity needs not just a space in time, it needs enough time. Again, from a personal reflection, particularly on the work we've been doing with Josefa and Francesco and others in the PHI space, the opportunity just to sit with an issue and not immediately move to solutions and explore it is incredibly valuable. Whatever you can do to arrange for some of that, you should bend over backwards to do, because it's not always the case that that's how things turn out. Okay, so in terms of leadership trajectory, I just want to give you a little bit of context for some of my personal comments. It's really important, I think, in the health and the private health sector to understand that there are different participants. Not just private hospitals, not just insurers, not just medical specialists and GPs and those who work in diagnostics and pathology. Like, that's for everyone in this room would be a no-brainer. You can segment the market like that. You can say, and what are the different private hospitals? How are they trying to differentiate themselves? They're not all of one sort. Where are they in their business cycle? And you can do the same for insurers. How big? Where are they? What are their individual challenges? And how are they trying to distinguish themselves? I think it's really important that you do the same when you think about engaging with government. So from a Commonwealth perspective, and talking about leadership, I think part of the question is why am I doing what I'm doing? And early on in my career, I encountered a really powerful woman who was leading a department. Her name was Patricia Scott. And she made a really important point, I think. She was saying to the Department of Communications, this is not a belief-based organisation. And that really made a lot of people stand up and say, hang on a second, what do you mean by that? We don't bring our own beliefs to the table as public servants and give it primacy. It's clearly important, it's who we are. Primary role for a public servant is to support the government of the day. They set the agenda, and why you want to be where you want to be is you're happy with that role of supporting the government of the day. I think it's a really critical thing for people to remember, one, when they're engaging with whatever participant in the sector, and government is a participant in the sector, puts in money, writes rules, does other policy things that we might touch on, is to understand in what context is that person operating, what is their role. the beliefs might be another point. I'm particularly wary about people who say I'm here because I'm passionate about this personal thing. I've got no views really about actors in other parts of the market, because I don't have deep expertise of how they organise themselves. But for a government officials, if they're saying, here's my personal agenda, I get quite wary. And we should be sceptical of that, because the direction for policy in health is set by government, and government's informed by a political debate where the community says, hey, this is what we want to prioritise. And taking it down a little bit further, the role I occupy, I get to exercise some delegated authority. I get to write some rules, sign some instruments about declaring hospitals. But I fully understand that's delegated. The minister has chosen to say, hey, there's enough specificity around that role that I can hand off some of my responsibility to officials within the department. But again, I'm only doing it on his behalf. And what else am I up to? Well, in doing that, I like to think about, am I making a policy or a particular decision for myself, or is it against a criteria? More criteria, feel really comfortable to exercise, the less should be talking with others and engaging their views. And the last thing I want to talk about before I actually get to some of the stuff I've been doing, but I think context is so important. It's the operating environment when you're talking about, well, who they are they a leader, what's contributing to their decisions? People talk about doing environmental scans. So what are the constraints that individual or that organisation is operating under? From the Commonwealth perspective, some of their constraints are, have we told people what we're doing? If we've told people what we're doing, we've got a mandate, we have the resources to do it, and we're aware of the risks of doing it. They're the major constraints, considerations in pursuing an initiative, understanding the risk of being able to deliver against it. As an individual who wants to focus on their job, part of my responsibility and other people in the Commonwealth is to understand government has other priorities and it's got a broader agenda. And this government's got a really clear agenda, which I think lines up neatly with the private health insurance agenda. It's called cost of living. Affordability is a massive issue for this government. They want people to be in a job, earning a living. PHI is a big cost on individuals. So playing in that space, health policy, private health insurance, understanding where it sits in government's agenda is important. There's some other stuff currently happening in health that relates to private health insurance. Government's undertaking this massive exercise of engaging with the community about strengthening Medicare. PHI keys off the Medicare benefit schedule. There's changes there. There's changes about how care is coordinated. You have to be conscious of that. Government expects the Commonwealth or the policy official to be conscious of it. They shouldn't have to be telling a policy officer, can you think about the other things that will interact with your particular policy? Okay, so touching on personal leadership trajectory and Giuseppe, if I'm dwelling on things or not touching on issues, please help out. So here's a few observations on where I've got to. or how I've got to where I am. First one is good fortune. And I think I share it with almost everyone in this room. We're just so fortunate to be in this country, to have the institutions and so much support around us. There's other people that's not so fortunate. So I think it's really important to always remember, reflect how fortunate we are, and we have very little control over that. Other things I'll touch on: experience and opportunities. Education is one of them. Learning from others, and most often always think up. I think most of my learning is from peers and other team members, but had the opportunity to look at great leaders and role models. I've been fortunate as well because stuff I work on, it's not my work. The more you go up in an organisation and occupy middle management jobs, leadership jobs, it just relies so much on teams. So if you get in a position where you're part of a team, like be it the leader or one of the team members, just so integral, everyone's contributing. And again, that's why I deliberately made the point about the engagement with Giuseppe and Francesco. People who want to work in that environment are genuine and really generous with their contribution. Makes a world of difference. And I've been lucky enough to make some really sensible, from my perspective, career decisions. And most of them have been looking for things that might be going off the rails and trying to get into the ground floor. So one case for me was making a move from the Australian Competition and Consumer Commission, where I joined at a very low level in the public service. I was looking at the debate and I thought, there's something happening in telecommunications. There is something happening here. It's going to be really important to the economy. And that was that transition from dial-up internet. And back in the day, I was responsible for a really big measure. It was to enable people to have access to 19.2 kilobits of internet connection, which is the slightest trickle. But even working on that, you can see where the future was going. Off the back of that, I got to join the Department of Communications, work in telecommunications competition policy, work to great leaders on that, and experience several attempts that government made to establish something that became the National Broadband Network. So from a career trajectory perspective, identifying the opportunity, that's key, and being really happy to join early on as things are still getting sorted. Personally, that's been something that one found very valuable, coming to something as issues are being worked up and problems that are attempting to be solved, as opposed to once it's established and coming into something that's fairly steady. On a career perspective, education perspective, I've got a Bachelor of Science. I was a very middling student. I've got a Bachelor of Arts. I'm sure I was a very middling student there. So I was interested in physiology and philosophy. I think from one perspective, two great disciplines within government, because they're about ways of inquiry, ways of trying to organise what is the issue, how might you investigate the issue, present evidence or argument, and then try and resolve. There's a passing comment around philosophy, and I shared this with Francesco yesterday afternoon. Two of the academics that I like to follow, not necessarily in the health space, they're both based out of the US. Luigi Garland's in the University of Chicago, and Michael Sandel, both are big advocates of saying, hey, why do we do issues of ethics in a class over there? And we've got other real world topics over here. And I suggest there's a lot to be said bringing those two together. A little bit off topic, but I thought I'd share that observation with you. One, because I think it's really important. And it's important to be able to have those discussions joined up. Why are we doing this? what is the impact of this on people? In terms of places I played in, ACCC, I mentioned the observation around the ACCC gave me a great experience of one perspective in government, the perspective of the regulator. They play such an important role. Good regulators cherish and work to maintain their independence. They're very careful about boundaries. They develop such deep expertise. They look after that expertise. They invest in it. At the time I was at the ACCC, it was led by a fellow called Professor Alan Fells. Really inspirational. I think the thing that I took out of my time there was whoever was responsible, and he was the chair of the commission, if you were working on a matter, and I was a very, very junior officer, if it was my matter, I was presenting it along with my manager to the commissioners. So empowering staff, letting them speak directly with the decision makers was an extremely valuable experience, and it's kind of informed how I like to go about things. Do I do it enough? Probably not, but involving more people and engaging with decision makers and other stakeholders is critical. There's another fellow who's was in that in the ACCC working in the telecommunications space for close to 25 years. His name's Michael Cosgrave. I think he's recently left the ACCC. His ability to maintain teams, maintain expertise, has such a great esprit de corps where everyone from an outsider looking in knew what they were about. We're on the same page. I think it's if as a leader, that's what your legacy is, you establish and can build those teams. That's a tremendous thing. And if you ever get the chance to run into Michael, take that. He's currently working with a firm called Plum Consulting, I think. And over in the Department of Communications, again, it's just an issue of how it informs my approach to policy. I worked on telecommunications and competition policy. It was great to be in a policy role where there's, again, a number of regulators. So we've got the Australian Communications and Media Authority, the ACCC is involved, understanding the interaction between policy agency and a regulator. They have different agendas. They go about things a different way. Really helps think about who your stakeholders are, how you need to engage with them, what contribution they can make. From a really important policy learning, the Department of Communications gave me a chance to do two big pieces of work, in my view. I got to run my first tender. I ran a tender for some optical fibre backbone between some state capitals and regional centres. It was for $250 million. Understanding, like, one, how you do it, but two, that's a really important policy role. Policy is either government doing something that's quite low cost, standing up and saying to the community, this is where we're going. Informing that, enabling that for someone to stand up and say, this is the direction, that's policy work. Government does another big bit of policy work. Puts money on the table. And how it goes about doing that to achieve value for money, in my view, it's just as important as someone standing up and giving direction, or writing some legislation and getting it passed in Parliament, or writing some rules. The opportunity to work in that environment, if you can find it, I think is extremely useful. Extremely useful. The other thing I got to do in the Department of Communications was be involved in a delightful exercise, and I say that with my tongue in cheek, of a restructure of a government department. It's when we needed to move from an environment of about 600 employees down to 400 employees, and the decision was taken, everyone would have to reapply for their job. Going through a process like that emphasised the need to turn up, be genuine, keep being available to communicate. There's also managing stressful environments for yourself and for your team members. If you get the chance to avoid something like that, do it. But equally, very formative in working with people and understanding how real things can be for people. I guess that's why I like health as well. And that's why I think I get out of bed each day. There's 14.4 million Australians that are putting their hand in their pocket to pay for private health insurance. That's a lot of people. That's a big motivator to think about their interests. I also like to think about it another way. There's 24 million of Australians. And if there's 14.4 who are making an extra contribution to their healthcare, takes the pressure off the system to fund high quality care for the remaining 10 million. And within the Department of Health, I've touched on where I'm heading and how I'll step through some of the initiatives we're working on. But just to go back to the key thing, it's a policy department. Policy, in my view, has a number of levers. It's government making pronouncements, talking to people, setting the direction. It's funding, and there's rules around legislation, so on and so forth. But of course, there's also the cycle, and this is real to me and how I organise or try to organise my work around some of these initiatives. And there's lots of documentation available through the Australian Public Service Commission and other entities just around the policy cycle itself. You should observe, measure, and you should form some ideas as to how you can amend, improve, or initiate. You need to deliver, and then you have to monitor. And that again should flow through to whether you need to amend. A big trap for many of us, and I've done it myself, is to get fascinated about the really sexy thing of amending something or initiating something and not observing the consequences, or not having enough structure that says, I'm not capturing information around the benefit I'm achieving, or whether the risks that we thought we were going to avoid are coming true. And most importantly, because it's a human exercise, what unintended consequences was that initiation giving rise to? Okay, so I might touch on, unless there's some questions or challenges or queries, I might touch on some of the current challenges in PHI. Yes, Francesco.
Yeah, no, I mean, to break the ice as well, maybe ask some questions. I mean, curiosity is really. I liked it. I mean, I have a few, but I'll just go random. I liked the why part where you described and I summarized it. There are some interesting things that we often don't think about. So the role of government, which what we mean by it sometimes is not just the elected government, but government in Australia means bureaucracy, right? Or bureaucracy also has many connotations, but administration, really, which is the continuum, right? That's what's always going to be there unless there is a coup d'etat, right? And then they change it, but there will be a bureaucracy no matter what happens or whatever can. So I like the idea that you gave about how you interpret your role, which is in many ways, how I share that interpretation, and I think it's really in the public service mission. So the support to whatever government, and which also needs sometimes to conflate, or if you want, um, uh, be balanced in a certain way. And it's a difficult exercise. You went through it very quickly, but the government support and the personal agenda part, right? So that you have to park. That's where in and itself might be very complicated. Not because you don't support that government in general terms, but maybe because there is an ethical dilemma or and you could go around the world and think about a lot of very extreme situations, even in modern democracies. Like I'm from Italy, we probably could spend a good hour describing how many public servants must have felt when one or the other leaderships that we had in the past decades when in power. So without going to a direct question on how you feel, because that's out of the scope of my interest, is how do you manage that from an emotional and if you want also personal emotional perspective, right? So, because there are challenges all the time. What are the tricks? I mean, if you can give us some secrets.
I'm not sure there's too many secrets that I have a checklist against. I think I don't want to oversell academic training, but what I got from my training is just being able to try and dispassionately organize your thoughts around an issue. Not make it too subjective. Try and be objective. What then you can reflect on and say, how do I feel about that? Have I done a good job? Do I see any of my biases in there? The more you can talk about your own personal preferences and share them with your colleagues, then they know where you're coming from. They'll help contribute to something that is objective. So recognizing, sharing biases, trying to challenge each other. What are your biases? That's really important. The other thing around that, I guess, Francesco, would be is that pride in your work. I'm being so well remunerated. I'm being paid to develop something so someone can make a decision of the pros and cons. I want to present the arguments persuasively, but what I take pride in is knowing that my job is about informing them about the decisions they need to make. And it's not being confused that I'm going to try and push them in a certain direction because that's what I personally want. It's as much as possible. That's where the data, that's where you're monitoring your evidence collection, your risk assessments are driving you. I guess in a part, how can you avoid that bit of trap? It's not doing it in isolation, not writing it by yourself, owning it by yourself, and then delivering it. It's getting, as I said, generous people to contribute genuinely about what you're trying to achieve. And that's, leadership is awesome because you get to pull teams together to check and challenge. I think government also has a really useful way of avoiding the public service giving an agenda because it just doesn't talk to the public service. And there's an economics angle here. The public service does not have a monopoly on advice to government. And it's lazy thinking that whatever the public service, the bureaucracy produces as precedents. Like that's a trap to avoid. You're almost aware that your work needs to be compelling because there are others who are putting a position, as they should be able to, directly to the minister or the government. So it is contested. Government has another great way of contested advice. And within a ministry, we're really aware of it. if there's an issue, particularly around funding, it's contested at the cabinet level between ministers, Minister for Finance, Treasury, where they debate about priorities and they check and challenge the information coming forward, as opposed to rubber stamping. So being able to operate in that environment is extremely useful as well. That helps you avoid some of those issues because you've got process, not just good intent. Does that kind of go?
Very good. No, yes. Sorry, I would like to follow up on one aspect. So it has happened to me when working for politicians or governments, that they come with the vision, whatever that is. I would say that to make a history think about my personal experiences in that. I would say that maybe I have observed a changed approach to the way in which these visions are formulated. And that is contextual. The world is changing, priorities are changing, politicians are changing. But without getting lost in what I want to ask, sometimes it's very hard to interpret even some of the big visions that come to you, right? For example, in my case, which is in some sense similar, right, to what's been happening in the Australian context in Chile. So Josefa actually and I and a couple of these guys were doing that work. We were basically asked to integrate two systems. In a nutshell, the public and the private system, with nearly no public resources to do it. So when that question came about, of course, it's fantastic because you have a lot of creativity to come up with ideas and so on. And then, there is a feedback to that because you finally nail it. I got the policy, it's fine, but that is not politically necessarily something that you can really achieve because the minister knows other dimensions. So you are navigated now public service. You've been in and around. I mean, I was acting in fact as a consultant, a different game altogether. How do you what's your experience with this feedback back and forth? Also because you work through government cycles. I don't know if the question is clear, but I want to get a sense of what your experience has been.
And some decisions or visions, directions, generally cannot come with much information or analysis that supports whether it's practical, pragmatic, and that could be a plus and that could be a minus. So on a plus side, if a policy is not over-specified, it allows people to contribute and do a bit of design work and test different solutions. And rather problematic, you can get into a problematic space where the direction is provided and it entails a lot of specificity as well, but perhaps not supported by a lot of information and evidence. That can be quite constraining and in some instances be quite difficult to say to whoever generated that idea, not going to work. It's really important, and I've seen it done before, where you've got leaders who are able to go in early in the piece and try and contest elements of a policy direction. Because you'll find yourself potentially in the space that you've described, Francesca, and I've been there as well, where your hands are tied pretty much. You've been told what to do, you've been told how to do it, and it doesn't line up with either the resources that you've got or the facts on the ground, and it's not going to be able to be delivered. Be able to call that early is so important. Whether it's possible is another matter. So that's quite challenging. Things that I've seen that inform me about how to avoid that, when people have been engaging in a conversation without trying to determine the solution and collect the information early on in the piece. I guess one of the reasons why the Commonwealth government has a default position, and perhaps we can do it better, of releasing more information, whatever it is about, transactions, services, having an open data policy. Generally, one of the wins should be one, it informs the rest of the community so they can make decisions. But if there's a policy debate to be had about not just the direction, but how you might go about doing it and the risks and issues that arises, greater transparency, more access to data, and as I said earlier on, a reasonable time period for people to engage in it, as opposed to narrow windows with not a lot of thinking through what is a sensible timeframe to implement. The more compressed that is, I guess the higher the risk is. I won't go with generalizations. From a personal perspective, I work better when I've got a little bit of time to reflect and hear from others, reflect. Not always do you have the opportunity to spend a lot of time on things.
I mean, Brian, I'll take you. It's important, I think, also for their course of study. So, in your experience, the use of delegation changes, cyclical. Do you observe a trend towards more use or less use of delegated authority in your experience and what is your sense about that instrument in general? For guys, that are gonna go out there, maybe working on, maybe in another countries, how to interpret what's their relation, because it gives you great responsibility. It is delegated. It's a very fine line between what you said in terms of personal and fact, public services, serving or supporting the government. So,
I think it's very, very specific to the circumstances. That those sort of arrangements work well when the person who's been given that authority has a clear set of criteria. And then it's just a large part, really efficient way of delivering against a policy agenda. So if you've got an established criteria, people's roles, responsibilities, accountabilities are sorted, there's checks and balances in place, just crack on and get it done, because the whole issue around government is achieving things. So if that's an efficient way of just getting a decision made so people can go to the next step. So say for the instance of one of the parts of my responsibilities, declaring private hospitals to be eligible to receive private health insurance benefits. Parliament has decided this is the criteria. I've got a team who makes sure we get the information, we can relate it to the criteria, we've got review processes. We don't need to involve the minister in that. It's got better things to do. Let's just crack on and make the decision. So that's when it works really well. When it's weighing and balancing competing priorities, necessarily it needs to go further up the chain. And as I said, there's processes within ministries or departments that help argue and contest that. There's processes between ministries and processes between ministers. And the more contentious it is and the more value judgment it is, that's where it needs to go. They're elected, those women and men. That's their job. The public service shouldn't be looking to take that away from them. public service should be supporting them in making those decisions. Lots of things around values and competing priorities and where resources are allocated. Thank you. And I was going to move to talking about some of the stuff we're doing in PHI. It's really important from my perspective, is to talk about, what challenges and how you go about organising to deal with them. But before you go there, I think you need to consider challenges in the context of objectives, not just challenges per se. Private health insurance, from my perspective, has two major objectives. The consumer or the citizen, the individual citizen, and the health system. The role of insurers, private hospitals, and doctors, they're secondary. But the individual accessing healthcare, going to continue to remember that's the priority. And then from a system perspective, because that's what health is, especially in this country, complex adaptive system. What are we doing in the private health space that contributes to a better overall system? And in Australia, we run this public-private system. So that just adds a little bit more complexity. But they're the two major points of objective, if I put it that way. Focus on the challenges around what does it mean for those two things. So the initiatives I'm going to talk about, there's three things. I'm going to talk about, we're doing called the Medical Costs Finder. We'll talk about work we've done around COVID-19. And we currently have a bunch of studies, initiatives around improving the private health insurance legislative policy framework. I'll try and talk a little bit about what is the issue, what's been our approach, and potentially where to next. Again, I said I like to talk about context. These are all PHI matters. I presume most people have their own view as to what's the current context around private health insurance. I'll give you a couple of just observations. Happy to spend more time on it. I don't want to be too flippant, but in Australia, I think around private health insurance, we've got a 1980 system for a 2020 problem. I think too many of our arrangements haven't adapted to our circumstances now. I think they were largely optimal in an environment where an individual was ill, had a particular specific condition, were able to see their GP, and it was quite a one-off intervention. And if they were really unwell, the GP would get them into hospital. And there wasn't much in between. Now that's an oversimplification. The system largely supported that and was arranged around that. That's not what we have now. And what we have now will quickly evolve into something else far more quicker than what it's evolved from 1980 to 2020. And what's doing that? That's the technologies that are coming onto the market, the changes in costs, it's the changes in disease conditions, and importantly, it's the changes in consumers' expectations, individuals' expectations. One of how they want to deliver healthcare, but importantly, how the person wants to receive healthcare and what's the best way of delivering that care to them. I think that the technology angle is massive in this space. It's been important up until now, and it's just going to escalate. And thinking through policy issues and where things might evolve, having an appreciation and particularly knowing who to talk to or tap into being able to frame, ask questions about where those trends, what are those trends, how do you size them, what are their potential impacts, are really important to thinking about your own policy issues. I guess on the technology side, amongst others, it's been about exchanging patient information, been about the devices themselves, but I'd say a large part, we're getting to a better position of exchanging information and working with that information. Decision support will be increasingly critical. Systems that actually allow the GP or the medical professional to not rely solely on themselves, but have some support. If this is the information you've keyed in, have you thought about X and Y? Not necessarily say you can't proceed. It's got benefits primarily for the consumer, but for where I come from, PHI, thinking about financing, it's got massive issues around financing. You can have more integrity and insurance about the decisions that give rise to treatments, but also give rise to payments, and collect information around that. It's a really powerful thing. So before moving off those, pause, see if there's any contributions about what people think are some of the challenges, because that's a really brief description. There's a few other challenges out there that I presume people in the room say, hey, you've missed X, Y, and Z. Got a little cheap list in front of me. This is some of them. But if I was to say, and from the perspective of the consumer, from the perspective of the system, looking at PHI, so what does it mean for the consumer? I think the real challenge is out of pockets and the difficulty to value the product, because our system is so complex. It's hard to value something if you're not sure what you're covered for, how you're meant to navigate the system and maximize the value of the product, and where are the instances that give rise to unexpected costs. I think from a PHI perspective, we've got a really complex product. We've taken steps to simplify it, but from a consumer, maybe from the perspective of one of them, I don't want to think about my private health insurance. I really don't. I want it there to be used when I need it. Try to think about it when you're in fairly healthy condition. It's just not how you go and live your life. And that should be a real part of considering what is the current policy? Is it optimal? Well, from a consumer perspective, they've got to be able to understand it and use it when they need it. And we shouldn't be putting too much onus on the consumer if it is complex. I think that's a real issue we need to come to grips with. It's not a matter of government, whoever it might be, saying, here's a lot of information, go and inform yourself. I think there's other actors or participants in the system who are far better placed to take some of that pressure off the policyholder. They're more sophisticated. It is their day job. So that's another pressure. Touched on burden of disease, that changing profile that we're going to, and that's going to a real issue for us and what we're designing in terms of policy currently delivering and how we might do it differently. I think there's some other really important things. Medicine is increasingly being corporatized. It changes the way people work. And trying to get a grip on what does that mean in terms of then how they deliver services, how people can access services. Really important. And I'll put my hand up. I don't know enough about it. but it's a trend that's out there. So I'll go back to the points that I was going to investigate with you. The medical cost finder. Back in 2018, the current secretary of my department, who was then the Chief Medical Officer of Australia, was asked by the then minister to come forward with some ideas about additional contributions that could be made to help consumers understand where out-of-pockets in our health system arise from. I guess the main first point for me to stress to you guys is the initiative I'm talking about. There was the first stepping stone was back in 2018. The Chief Medical Officer engaged a group of medical specialists and others about talking through what is the issue and possible options. We developed a proposal up, and the government at the time said, proceed with this initiative. And it had 3 parts. Build a website that would provide information to the public at an aggregate level about what are the services out there and what are their typical out-of-pocket costs. Go and reach out to individual medical specialists and ask them to contribute their own fee for their services and have them publish it on the website and do that voluntarily. Then communicate this to the population that there's this resource there. Publishing aggregate information on a website, that should be a doddle. The data's there in Medicare, you just need to extract it and put it up on a website. How have we gone about it? It's remembering who are you doing this for. Generally, you're doing it for a readership, an audience with a readership of about year 8. That's our community. That's where we need to pitch information to. So you have to understand your audience. We've been so privileged because we've been resourced in delivering this initiative to not just grab lots of data and try and present it on a website. We've had the time and the resources to employ with expertise to present models of that information to consumers and refine it with them. It took quite a while to publish. So 2018, an initial decision, end of 2019, the first pass. We've iterated on that and only recently done another way of presenting that aggregate information. Lots of different ways for how consumers can find what they're interested in. But we didn't think that up. We actually had to park our internal designer, because I know how I would present the information. That's not important. It's how will the audience you're trying to communicate want to consume it. Being in a position to test and test again and iterate has been so important. And we've got great feedback on the way it's been designed to present aggregate information.
Ask the question.
Yes, please.
So of course, this intervention and this communication is very important for the community, as you said, right? My question is, wouldn't this a role for a communication that the insurers must do as part of their task for the community rather than the government, which of course regulate them? But, I mean, the profit of the insurers not go in the government pockets, right? So shouldn't the insurers be more empowered, accountable? For this?
That's an awesome question.
Can I have a follow-up maybe to what?
He has an answer.
Yeah.
I know, but I think you can answer 2 for 1.
Uh-huh.
that I was thinking something similar in the line that, you know, I think it's super interesting for the government to say, well, individuals are having issues understanding why things cost, how much you know, they're costing, or what the cost of getting a knee replacement is versus some other intervention here and there. That's very complex information, and it's very important to have it out there. But maybe my follow-up to Marcello is, well, the complexity is happening because of how the system is designed. So as the government, you could design a system where the medical cost finder wouldn't even be necessary, right? Because
Totally
you
agree
would
with
you would remove maybe the issue about individuals having to know such complex information about prices of medical care in different providers or among different types of services. Like how, my question to you now, given this comment, is how does someone from, you know, a leadership perspective kind of manage this type of things and maybe say, well, haven't you thought that we should also think about, in the meantime, we're developing this to solve an issue right now, think about the root causes of this issue, and as the government, in a long-term vision, design something that is long-term, like sustainable.
So kind of almost in reverse. A lot of what we do is not thinking one thing is a silver bullet. If only you do this, then the problem goes away. Trying to be really clear what is the benefit and the limitations of this intervention, and not just recognizing it ourselves, but communicating it. So what could government have done when it was encountering this issue about out-of-pocket costs and it being given, being just a function in part of the scope of PHI and the complexity of the system, and a system based on transactional fee-for-service payments, because we've got to solve that big problem. Everything will wait, but they haven't done that. I think there's increasing recognition, and the Strengthening Medicare Task Force report points to it, but government's generally quite a slow beast, needs to work this through. So you make interventions like this cost finder, but you understand its limitations while you're also trying to progress a broader agenda. So you might say, well, really, I'm not getting to the heart of the problem. Well, you can own that and still say it can deliver value and it's a stepping stone. And I think from a policy perspective, it also brings to light more information about the exact issue you're talking about, Jason. People look and say, yeah, but it's still only information about a particular transaction. There's other problems around it. That's a useful intervention. To Marcello's question, there's a couple of observations I make. If I summarize your question, why wouldn't you just say, come on, insurers, do a better job? One, the insurers are competing. And you have to own that. So they're allowed to do whatever, to a certain extent, they want to do to talk about their own products. From a government's perspective, we want to support consumers to have a view across the products. Because there's complexity and a fair bit of variation in the products, maybe the need to provide some more information that helps that comparison. The insurers won't do that. And from my perspective, while you think that might be desirable, I don't think it's a practical, pragmatic way to proceed. There's a role here for government. Provide some information, understanding the limitations. I think there's also a lot to be said from a consumer's perspective, where they say, hey, this is not insurer ABC, or EFG presenting the information, there's that crest on it with Australian government. And ideally, the feedback we've received is, hey, I've got some confidence that you're not trying to sell me something, you're trying to present information in a useful way. But if it came under a brand, be it an aggregator, well, they might have agreements with some insurers, but not all. You have visibility about, and this was a real issue in this project, you have visibility about who gets to be first in the list, who gets to be second, can you pay for your entry to be higher up and more visible, or vice versa. Like, benefits of government generally, and why I like working in it is there's a lot of pressure to be very, very fair, accountable. In legal actions, talk about being the model litigant. In these interventions, yeah, there's a lot of onus on how are we being fair to all parties, and I think that's of benefit to consumers in this case as well. Our approach, getting onto the second part of the initiative, so we've got the aggregate data, we got resourced, take our time in design, but also actually use expertise in design. Second part of that initiative is not using government health data. It's going to medical colleges and individual medical specialists and saying, for the first time, you put your fee on a website such that when a patient is being referred to you, they have an appreciation of what your fee might be. I think it's a really hard ask because it's new. There's a real cultural element here for a specialist to do that. But why go down that path? From a cultural perspective, just a human perspective, I as a patient, finally getting in to see my specialist for a health condition I've got, when I've been told the price, but I'm sitting opposite them or already formed that relationship, it's really hard to back out. And a lot of people tell us, price won't be an issue. I'm prioritising my health or my family members' health. So expecting an individual to be able to form a decision about whether that's a reasonable price or at least just get comfortable with it and have a shared, informed decision with their specialists, giving that information a little bit upstream is so important. Now, not every patient or consumer policyholder will want to do that. Some do. Some of their care group want to be able to do it for the patient. And this is what user research helps call out, and you get to discuss this and then share it with the medical specialist as to why we want to proceed down this path. An angle here that says also, if you've got just enough patients who generally expect a higher quality of discussion around fees, the behaviour of the fee setter, the doctor, is going to change because they're now accommodating that 10 or 15% who want that information. They're just going to do it for everyone. So there's a policy intervention there that's changing behaviours. Big behaviour, though, I want to talk about is how we went about designing this site that's only, the enhanced one's only been released. It's an ask of specialists to do something that they don't do, which is publish their fees. Again, put it down to part of the conversation we've had. Government gave us the time and the resources to sit down through for each specialist college, and we've involved 11 to date, to engage with the leadership of the specialist college and say, hey, this is what the initiative is about. We're going to find some services that you deliver for your members to put their fees against. And we've got some views as to what those services are because we've looked at the data. We know your high volume services. We know the services that generally give rise to out-of-pocket payments. We could present that list. We don't want to do it without you. So they nominated people who, through a series of 3 or 4 3-hour workshops, would run at the time with us to get across why we were doing this. And they didn't have to believe in it. They weren't there to say, yes, we'll be part of it. They were there to contribute their expertise about identifying what would be appropriate services for their patients. What would be the risks of putting some services up there because of the complexity, the pricing might be so broad in range that no specialist would feel comfortable with just giving an indicative fee. So helping us avoid those design risks. 3 sessions, generally over the course of 6 to 9 months. We set it up, give them the information, come in, let's spend time together, face to face. Let them go away, give them feedback on what we found through that. Here are our revised designs. Can you comment on that? Here's the data. Plenty of time to deliberate, consult with their colleagues, and then come back into the room. Another awesome thing we did with them, and this is chipping away on some of the issues you raised, Josefa, is it just is not about an individual fee. But what we've started doing, informed by the specialists, saying we can build typical patient journeys. So if you have this particular treatment, we can hit the Medicare database and say, typically, if that's the treatment, you're going to encounter these other services on the way through and post. We get to sit down with doctors and say, what's the relevant time period that we should be looking at the data? Is it 180 days in advance? Is it 60 days in advance? Is it 30 days in advance? Here's what the data says, which are the right ones. There's value for them in seeing that data. It also, exposing that, demonstrates to them we're genuine and we're generous about sharing information so we can get a product. That's medical cost finder. Back to one of your points about Charlie before I move off it. It's like just an insight into leading a team on these sorts of things is how do we capture the benefits? Where to? So part of it is building in more analytics as to how people go through that site, use information. 1, so we can improve its design. 2, we can provide feedback to the people who are contributing to it. 3, we can actually inform our communications. The other part I'd love to do with the site, but we'll see where we go. It goes to my open data point. Technology is awesome now. We can provide APIs that other systems can interact with it and pull that data and present it in a different way. I think from government's, my perspective, I've got no monopoly on the best design for all consumers. If we can facilitate other parties that we trust to obtain that data and present it to their consumers, their patients, in a manner that they think will resonate better, we should enable that. And being able to syndicate this information, it just increases the value of it instead of just holding it in one place. On COVID-19, the policy challenge, how we went about going this on the cusp of March 2019, was it, or 2020? 2020, way back when. In private health insurance land, we have an annual premium cycle. On the 1st of April each year, new prices come in. COVID was getting traction, and there was a clear understanding that with lockdowns and and also implications for people not wanting to go and obtain services, that the price that was going to be charged for a premium actually over recoup for an insurer. And the insurers, almost all of them came out and said, we as a group undertake not to profit from the impact of COVID-19. It's quite a remarkable thing when you look at the Australian economy as to how many groups said, hang on a second, if there's government assistance or we make too much money, we're going to give it back. There's an option for my team to say, isn't that a great undertaking? They've done that. Should we just let it sit? What's the role of government in this space, in particular the department? Took the view that that's an obligation that the insurers made to their policyholders. So one they need to deliver against. But there's a reasonable expectation that there's some assurance going around this public statement. But we looked at how do you define your role in intervention? And it was not, let's do a forensic accounting exercise on this undertaking. Let's work with the insurers, develop a framework for collecting the information, having some rigor and consistency around the information that they provide, and then report that out to the public. So the policy intervention, you might say, is around assurance. We're not trying to intervene and organise the insurers. I say, where's the value add for the community, for an individual? So is anyone keeping an eye on them? How was it delivered? It wasn't delivered by the Department of Health. Department of Health, working with the insurers and two regulators, the prudential regulator and the competition regulator, looked at the information, one designed the framework, looked at the information coming in. The competition regulator reported to the Australian Senate on the outcomes. Department of Health was able to report to the minister and publish it to the community to provide assurance. And we're going to do that again this year, collect their undertakings to 30 June, what they've delivered against. Report out in September. There's a couple of angles on leading teams there, or contributing multiple teams in terms of regulators, really genuine early engagement through the peak bodies of the insurers and the individual insurers, giving them time to interact with us and the other regulators about a sensible fit-for-purpose framework, collect the data and make it available to the public. Where to, for an industry initiated undertaking, some people might say, is that really the space you want insurance to be in, where in those years where they over-recoup, they give back, versus the years when they under-recoup? Are there any particular arrangements there? That's not the case. I think the challenge for PHI is to say, how long do you keep this obligation alive for?
Right. Sorry, on that point, were there, at that point, there was a lot of discussion, before actually that point, I remember even myself thinking, wow, the insurers are gonna benefit from it big time, and then I had a second thought before this, was like, suppose they even do make a lot of money on it. The profits are gonna be taxed anyway. I mean, was there that, because I forgot actually following that up because I was busy thinking about actually COVID. But for a moment I had that thought and I said, what is really like, it's a complex question. No matter how you address that issue, was that argument made? Was it at all like, look, because in all what you're saying is or at least not what you're saying, what I'm interpreting is that, well, that was certainly a good response by the industry, very positive. The government could have taken very difficult position and say, well, look, we did some numbers. It's actually better that you do the profits. We tax you, and we invest in public goods, right? Which is kind of anyway, and that happens all the time. Right? That's where I'm going with this. You have the in economics, one of my professors used to tell me, you're trained to say always on the one hand and on the other hand and the other hand, So that's more or less where I'm going with this.
Yeah, well, I'm gonna probably only answer it partially because it's a really complex issue. The short answer is no, we didn't think about it that way. Because in my mind, there's a few things happening. There's a role for the minister to approve these premium increases if they're in the public interest. And there was a call out, hang on a second, the prices that have already been approved might overshoot. Thinking from an individual's perspective, they're paying the premium. They're making a contribution. A taxation outcome kind of says, well, we'll take your money and it might end up somewhere else. So just that kind of compact between the individual, government providing the assurance that that premium you're paying is fair value or there or thereabouts, that's really important. So I think it's keeping it contained. There's another angle, I guess. They are all the players at the same point in terms of how they would engage with that issue. And we've got 31 insurers now. Some are not-for-profits, some are restricted funds, for-profit, some are big funds, for-profit, some are big funds, not-for-profit. When they all come forward and say, hey, we want to go about it a certain way, you want to give some credence to that. Plus it was COVID. Okay, right. Plus it was COVID. A lot of things were happening. Maybe it was one of those times that we've talked about what's the window of opportunity here to make a really sensible, rational, fully thought through decision. And that's just the reality. That sort of stuff was happening in March. Prices start kicking in 1 April. So you work with what you got sometimes, and it's
interesting.
Yeah, it's interesting. It's
Very,
just
very,
the dynamics of it. How are we for time, by the way?
I know I'm 20 minutes early.
Well,
Repeating the mic, yeah.
I might.
Maybe we ask the students if you have any questions,
Also online,
comments. Yeah.
you have some comments?
Yeah, students that are online, if you have
to
any
put-
questions, just raise your hand or,
Do you have to put your mic on? Or
you know, like, they
they
can
can
put-
hear, yeah.
or you can turn your mics on and. You're having.
I've either preempted them or gone off topic. The last one I was going to mention about is we're doing some studies around PHI reforms. And the key message in terms of that exercise is just what I've been saying before, trying to collect the information. And these are quite unique studies in that we approached all the insurers and said, let's not use government health data. Are you happy enough to contribute your claims data and pool that? I think almost the first time in Australia we've gone about it that way in terms of collecting data to inform the analysis and to make findings. Another way we're progressing on it, it's quite a deliberate, I like to call it a two-stage business case. The investigation first phase is just about making findings. Are our regulatory or policy settings optimal, fit for purpose? Can we make findings about that based on data and give a general direction as to where we might go? then report back into government and say, based on this, do you want us to head down in any of these directions? So government gets to make the call, resource, prioritise, so on and so forth, like I was chatting about. That second phase would be a co-design exercise with the stakeholders to work it up in full detail, identify the costs, try and identify the risks, work through what is a sensible implementation strategy. Going to take a lot of time. If it's appropriately resourced and we engage well, we should get a far better outcome than rushing it through and not giving people time to work it up. But I might,
We have a question from Jono and from Gabriel.
Thanks, Esther. Hey, Brian, I was just wondering, thinking about the government's recent changes to super, if private health are having sort of risks or are concerned about anything the government might either have on the cards that they may change, or is there something that that might, that might cause a bit of turmoil in public health, or it go the other way and cause great reform or improvements? Is there anything that you're sort of, or the people in public health are kind of talking or thinking about?
yeah, I'll share a couple of quick thoughts, Jono. One, it's great that there's a discussion paper out there about objectives. It's a really good, sensible place to start before you go into solutions. From my perspective, you look at what is the intervention, superannuation, what's its purpose? So how does it fit with the idea from a health perspective as being also a resource for accessing healthcare? There's a couple of angles, perhaps. One angle, just from the system perspective, is if a lot of money is taken out of someone's super account early on, when they actually need to use it, they might require additional support from government through higher pension payments. One perspective could be, hang on a second, is the Commonwealth, is the government, other taxpayers getting value for money for someone to take a large amount of money out of their super, and then the government taxpayers having to make a larger contribution when that person would rely on that super? So is it an efficient way of that individual accessing healthcare, just from a financial perspective? I think insurers might say, hang on a second, we could help that individual out because we've got contracts in place with service providers. We've got a lot of expertise, sophistication in trying to negotiate a fair price with hospitals, so on and so forth. Would an individual operating outside of that arrangement get such a good deal for their money in a particular stressful time because they're trying to access healthcare? I think that's another relevant consideration. So there's a couple of things, John. I'm not going to suggest I've worked it through fully or where things will head.
That's great, thank you.
Yeah, thank you very much. Thank you very much for that informative information. My thought process is here. I want to acknowledge the fact that the between the government and the insurers and the community, they really do play a very critical part in actually informing policy around that. But I wanted to just ask, especially when we're talking about issues of COVID and what really transpired during the COVID session, that did any kind of policy development come up from the experience that we got from COVID? More so that during the COVID era, like you're saying, there were certain decisions which were made, especially by the insurers, to try to work around the burden of COVID, to say, look, well, this is what we will do. But afterwards, after COVID, when things settled, did it spike something that said the government, like, okay, now because of what happened, looking at the fact that this changes this pattern, moving forward, what can we do to try to bridge what happened during
Yeah.
COVID, so it becomes a policy issue.
And thanks, Gabriel. There's a couple of things I can say. One, on the particular issue in terms of the one we were working through, that's live in terms of what our thinking is and how the issues that insurers are facing around the impacts of COVID and the consequences of it, which are still with us. Like, it's still, a pandemic hasn't been called off and it's still having implications. We're starting only now really to think about the issues. Government has said prior to the election, when they came in, they would do a review of their response and government's broader response to COVID at the right time. And they're yet to initiate that review. They think there's still things that need to be prioritised before taking people essentially offline and asking to revisit decisions, analyse. So where we're at in the cycle, you might have thought, yeah, that was COVID 2019. I think it's still playing its way through, and a review which needs to be done. We're only getting close to that now. So just in terms of the life cycle of decisions, how the system will adapt, decisions will be reviewed and changed, and so on and so forth. That's going to play out in 2, 3, and 4 years' time. And maybe that's a less than desirable feature of government. It does take a long time for these things to happen. Kind of a bit of the operating environment and how you manage that. It's quite challenging, I think. But really incomplete question, but it's kind of interesting to see how these things, when government or government officials do get around to engaging it, there's still, government has to authorise that review. They all want to control it, prioritise people, put resources against it, and then manage that process.
I think that's great. Well, thanks, Brian. If you have other questions, of course, send